Thank you, Honored Chairman. Uh, Ladies and gentlemen, good morning. Namaste, Vanakkam, Selamat Pagi. I hope you enjoy the day. Uh, my task first is to talk on the impact of accreditation on clinical outcomes. We already heard words of wisdom from the Honored Chairman. I think if I ask you the question, does accreditation affect outcomes? What's your answer? Yes or no? Yes, it's a very sort of lowered voice, yes. So can I ask again, yes or no? All right. So there is, anybody said no? Be brave, say no, if anyone wants to say no. Okay, so I think I can go and sit down again and save this time. We have already covered the lecture. But let me now go through some aspects of what I wanted to say. Excellence is a continuous process and not an accident. These words were said by your past president, who is a very learned gentleman. Now, what I'm trying to take you through is, I will give you the tenets of accreditation and the proof that it works in many aspects of improving outcome. But I'll also put before you the argument that accreditation is only looking at the system, but what is important is the people and their qualities, as well as the leadership and their qualities. That is what will ultimately make you whether you are successful in ensuring the safety of the patients. We all start medicine, at least I started medicine about 35, 40 years ago, thinking that I will not make a mistake. Right? Engineers start their profession thinking that everything will go wrong. So when they design a building, they will look at all possible sources of failure. Whereas doctors walk around the wards thinking nothing will go wrong. All right? That's the basic difference between a doctor and an engineer. But in the patient safety movement, we have to make sure that we understand that hospitals are actually very dangerous places. All right? Because many things can go wrong. And sometimes we only know part of what goes wrong because a lot of it is hidden. And I think accreditation is one way of bringing forth the major part of the iceberg out into the open so that you understand all the eventualities that can lead to unsafe conditions, near misses, incidents, and so on. The patient, once he gets into hospital, is under tremendous danger. Every process, from taking a history, from examining him, to forming a clinical diagnosis, to forming a management plan, and then administering drugs or performing procedures or investigations, interpreting the procedures and the examination results, and then monitoring him for improvement can have harm, potential harm. Right from catheterization, intravenous cannulation, central venous cannulation, drug interactions, and so on. So I will take you in a snapshot from my own experience from a micro level when I worked in a hospital as an obstetrician and gynecologist, where I once had a patient who fell from the trolley with her baby when she was being wheeled from the labor ward to the ward after a normal delivery. Why? Because the trolley, which had 4 wheels, suddenly had 3 wheels, tipped, and the patient and the baby slipped to the floor because the side railings were not raised. All right? Now, is that my problem? I think it is, because the patient ultimately is under my care. And then we have got, on a macro level, as a gynecologist, I was very much involved with the reduction of maternal mortality in Malaysia and looking at systems that created that reduction. Malaysia is a successful example of a country that has reduced maternal mortality from over 500 per 100,000 deliveries at the time of independence in 1957 to now about 25 per 100,000 deliveries at this current time through the implementation of various systems. So I put forward to you that the system of accreditation and the safety culture that it brings gives good credence to all our efforts towards improving patient safety. It is often said that it is difficult to measure the impact of accreditation. But I think in any accreditation framework, we have to look at the organization. And it is the organization that determines whether accreditation will bring forward benefits. An organization is made up of people, structures, processes, and systems. And you must have a learning organization to benefit from accreditation, and it must be integrated throughout the system. Accreditation is acknowledged as a quality improvement tool that instigates improvement initiatives at the level of processes, structures, and outcomes. But several factors will affect what you can learn from it. The age of the organization, the type of people who are in the organization, how they take note of the lessons that can be learned, and whether you have institutionalized the capacity for change. Organizations that have less capacity in this area, who are trying to change, sometimes run a dangerous path, because when you implement change without proper safeguards in place, you can have a problem. Jeffrey Braithwaite, who is from ISQA, has posed the question on why there was so little evidence published in peer-reviewed literature about the effectiveness and value of accreditation programs. I have now put forward at the end a list of references that gives you the evidence that accreditation can bring forth effective change. All these slides will be left with the organizers to be shared with everyone concerned who wants it. But let me go back to what we do when we train students as medical students. You have a system of medical education that is rigorously monitored by accreditation of medical schools. What do they look at? They look at the hospital facilities. They look at the number of teaching hospital beds, the number of students, the number of clinical teaching staff, staff-student ratios, number of support staff, simulation facility, rigorous assessment system, and so on. And the question to ask is, when we do accreditation, can you see that the quality of the medical graduate will affect the clinical performance? What is your answer? That means, when you have housemen who come to you, do you think that the quality of medical education they received at their own medical schools makes an effect upon how they perform? So that is what we need to answer when we look at accreditation, because healthcare services accreditation looks at quality improvement and external evaluation methodology, which is widely implemented in many countries. At the last count, at least 100 countries do have some form of accreditation methods. Accreditation is positively associated with the establishment of organizational structures and processes. There are improvements in patient care from, as I said, from micro level to macro level. There are promotion of quality and safety cultures. There are many other key benefits, and as well as professional development. If you look at how you yourself undertake accreditation, there will always be a period of sensitization and training before the organization embarks on an accreditation process. And what is an accreditation process? It's basically a peer review of what you do every day, every month in your hospital. And do you look at outcomes of your patient care? Now, once you have gelled into a proper system that makes sure that safety is emphasized, then you go forward to be looked at, where you invite external assessors to come into your house, so to speak, and look at how you function within your house and give you comments, which is educational in nature, so that you're always not perfect and you try and improve how you do it. All right? So accreditation is a capacity building tool. You do pay for accreditation. It is not free, but you would consider it an investment. It is a patient safety improvement tool. It is a tool for communication across teams and is complementary to the regulatory tool. Every country has got regulations. In my own country, we have got Private Healthcare Facilities Act with a lot of regulations, and accreditation will be complementary to the regulatory environment. It is a knowledge mobilization tool. You will share experiences across hospitals. It is a quality improvement tool. It is an innovation tool. It is an accountability tool. It is not a standalone tool and not a one-off where you do it every 3 to 4 years, but every day in between accreditations. I think that is vital. If your hospital is the one which will only kick itself into life at the time every accreditation rolls around, you will not be doing justice to the patient. So it has been a reality for over 100 years. There have been an increasing number of quality improvement programs in healthcare organizations. It is an inclusive framework, and it can bring synergy to many disparate and seemingly distinct environments. You have got a lot of management tools that have now come into place. You have learned about lean management, Six Sigma. It is felt by many staff there is a great burden of implementation, staff training and data collection. But increasing regulatory requirements also tend to improve patient safety and the quality of clinical services. I think in India you would have already seen that the government has now played a greater role in moving the quality movement forward, as mentioned, and now you are increasing capacity so that you can do a lot of it on your own steam. The focus of accreditation always has been on the system and how it effectively operates, from clinical care delivery through to effective governance. And the tools of accreditation are based on the standards that are core. I think standards are something that is agreed upon by all of you, all of us, in terms of the core standards which are available to the accredited organization on an ongoing basis. Organizations must own the standards. They must integrate it into their own psyche. This is not about doing something for accreditation. It is about doing something to improve the quality of care. That is vital to understand. That all your indicators, all your standards are not because it has to be done. It is there for the patient's sake. And by using accreditation standards and other quality improvement and patient safety tools, these improve patient care. Now, the tremendous value of the on-site accreditation, where you come into the hospitals, is important, and you must compare it with publications. You can compare it with publishing the article in a peer-reviewed journal. The evaluation by third-party accredited surveyors feeds into this desire to learn and do better. So I'm going to go on to what cannot be measured, cannot be improved, and the data that is obtained from the accreditation process, which is both qualitative and quantitative, is made available to each organization, and this provides valuable feedback to make improvements. Now, to wrap up all this in what is the clinical impact, you have the feature of excellence. I think all of us try to be excellent in whatever we are doing. There is a downside to pursuing excellence sometimes because you compromise on certain relationship time, less independence, less room for messing up. But the question is, should all doctors be excellent? Not everyone can have an excellent doctor, but everyone deserves a good doctor. So beware of the lollipop of mediocrity, and beware of some of the lessons we learned from the airline industry, where we now have the latest lesson from the Boeing MAX 8 story, where a change of the capacity of the engine and the shifting of the engine forwards created a design flaw, and because they were self-regulated and there was not enough checks on this, it led to major disasters. So, if you look at the alphabet, which everybody learns from the beginning of life, we can have avoid shortcuts, benchmark your standards, you can have a checklist, you can have competencies, you can document, you can do evidence-based practice, you can have feedback, which are all part of accreditation, right? Feedback is important to every domain of human activity. And I would like to leave you with this message, that if you look at the alphabet from A to Z, I can put forward all these qualities of every individual, which is covered by every letter of the alphabet, which will take you, your imagination and accreditation will get you anywhere. So I leave you with this message to reflect on, and I hope that you will learn from accreditation that if you want to succeed in medicine, you must see everything, hear everything, say everything, and finally you must also deal with the fourth monkey, which is the monkey that spends his time always on the smartphones and communication problems. So he is the sum of the first three. He sees nobody, hears nobody, and speaks to nobody, and accreditation must address that. So finally, it is maybe difficult to create a safe and just culture, but accreditation has continued to stimulate significant change for excellence, and the content and model of evaluation should evolve for maximum benefit and manage the cost of accreditation. These are all my references. Thank you very much. We hope to see you. I bring you greetings from ISQA. We hope to see you in Cape Town. And I also like to just leave a concluding message. The International External Evaluation Agency is now a part of ISQA framework for carrying out accreditation. Thank you very much.